Can you guys see everything okay?
We can. Looks great.
So as Carly just mentioned, Joy and I both work for Altru Outpatient in Grand Forks. Joy is currently working towards her driving rehabilitative specialty. Altru's Outpatient Rehab has offered a driving evaluation program for over 40 years. Joy and I are the current driving evaluators, although we may not be considered experts per se. We are speaking today from our experiences with driving rehab and our experiences with the different populations and clientele. So why is this important? In 2018, the National Highway Traffic Safety Administration had 6,907 individuals over the age of 65 that were killed in traffic accidents. 19%, which equates to 19% of all traffic fatalities. And then 63% of individuals with a severe traumatic brain injury were involved in traffic accidents with personal responsibility. So these statistics are important to note because it shows and reveals that driving evaluations and formal assessment of this occupation of driving can mean life or death for those on the road or in a vehicle, especially following a TBI.
So why is driving important? Driving is pretty much synonymous with our independence. We've grown up from when we were teenagers, learning to drive and being able to be independent all throughout our age or our lifespan as we're going through our different stages of life, you know, college, working, nearing retirement, that whole lifespan. So really important, we want to be able to drive ourselves to our shopping. We need to get groceries. We need to go pick up our medications. We need to get other essential things such as furniture, clothing, etc. We always like to be able to get ourselves to our doctor appointments and not have to depend on somebody else. We just take it for granted that we're able to drive to our social interactions. So we can do coffee or cards with our friends. We can go out to a movie. We can go out to dinner. And it's just being able to pick up and go is important to all of us. In our lifetime right now, we don't think much about the independence that it really brings us. But as someone is nearing that point in time where they need to retire from driving, that starts to be a very big obstacle that people have to overcome. And whether it's because of a medical condition or just the natural aging process, we all have that need that things are going to start to change as time goes on. So a group did a study in 2020, McNeil and Moore, that stated individuals nearing retirement from community mobility can feel a loss of independence, an increased feeling of being a burden on family or friends, and decreased participation in meaningful activities. And then successful driving after a TBI is positively associated with all those things that I just talked about, our independence for going to our leisure activities. It helps us maintain those social relationships that are so important. Helps to stay integrated into our communities. So driving is a mental and a physical activity. What we mean by that is you need to be able to make quick decisions when you're behind the wheel of a car. So you're driving down the street and this little girl comes running out in front of you. What do? You need to be able to quickly decide, do I stop? Can I swerve over? Is there a car coming at me so I can't pull over out of the way to avoid hitting her? We don't always have the ability to make a quick decision like that if we've had some type of a trauma, whether it's a TBI or a stroke or anything else. Visual perception is also really important for our ability to drive, and that helps us to differentiate the different objects that are in our environment. The little girl, the car coming at us, road construction that we might be coming upon. So it helps us to differentiate everything in there. When we look at visual perception, we're looking at visual acuity, which is how close or how distant we're able to see. Visual field or peripheral range are about the same. What that talks about is how far can you see out to the side without turning your head. So if you're driving in the car, you're going forward, can you see that car coming up on your left-hand side without turning your head to look? A lot of times after a brain injury, there is some deficits seen in our peripheral range of motion. We also look at contrast sensitivity. So being able to differentiate, again, as you look at the picture on the screen, can you tell the difference between the green grass or the gray street or even the yellow lines versus the white lines? Contrast sensitivity will help to differentiate those things as well. Another part of the physical activity, we look at all aspects of our physicality. So range of motion. Do you have the trunk control, the strength in your trunk to maintain an upright position when you're driving in the car? Are you able to turn your head to look over your shoulder when you're changing lanes? Can you even transfer in and out of the car independently? Or is there some other physical aspect of that that has caused some difficulty with that? So basic strength. Can you even hold your arms up long enough to manage the steering wheel? Yeah. We also look at endurance. How quickly do you get fatigued? And after a TBI, it's not uncommon at all for people to have a low endurance level, especially initially. So would you be able to get in the car and drive as close as from your home to the grocery store? Or would you have the endurance to drive from Grand Forks to Fargo or anything like that? So we look at those types of things. We also look at sensation. Sensation is the ability to feel the amount of pressure or the item itself, so that can you move your hand from the steering wheel and be able to feel the turn signal? Can you feel the amount of pressure that your foot is putting on the gas or on the brake? Those types of things are pretty critical when you're behind the wheel of the car.
Can you even feel the difference between the gas and the brake is another
Right.
thing with sensation as well.
Exactly. Coordination is one of the things we look at, because do you have the ability to, like I said earlier, move your hand from the steering wheel over to the accessory controls, whether it's the windshield wipers or the radio or the turn signal? Do you have the coordination, not just the sensation, but the coordination to move your foot from the gas to the brake and back again? Those are all really important physical aspects of our ability to drive. So we talked that driving is also a mental activity. So it takes a lot of cognitive skills to be a safe driver. So some of the things that we look at under cognition is our problem solving. So that little girl that ran out into the street earlier, were you able to make that decision in a split second so that you can avoid hitting her or hitting that other car that's oncoming? Are you able to notice the changes in your environment as the sun starts to set? Can you tell the difference between the lines on the road or between the shoulder and the ditch, that kind of thing? We also look at insight into deficits. And for some people, this is a very gradual decline. as we age, we start to not recognize some of the problem areas that we have. But for someone with a TBI, it's generally a very acute or a sudden change in our ability to notice that. It's not uncommon for somebody with a TBI to underestimate their risky behaviors. Even if they've been deemed fit to drive, sometimes it is difficult for them to recognize what is happening and how they're responding to something. So is that person easily distracted? So are they having difficulty with their attention ability? You know, is what's on the radio causing them to not pay as much attention to what's happening in front of them or behind them in the car? What is the short-term and long-term memory like? That relates a lot to our orientation, our pathfinding. What we mean by that is, can you still find your way to the grocery store? Or as you're going to this familiar place, are you able to make a decision as to what happens when I come across some unexpected road construction or a road closure? Can you find that way to get around that to your destination? And then we also look at abstraction. All of these things go so much together. There's such an integral part of everything that we do. But the abstract part, again, we're getting into a school zone. Can you differentiate that this is a different environment than even driving in the residential or the commercial zone? Because there may be a lot of other things happening in the school zone that we may not see someplace else. One of the last things that we are paying attention to when we're doing a driving assessment to see with patients' safety is their behavior. You know, is this person having a difficulty controlling their aggression? Do they get irritable very quickly? Are they impulsive? Are they having difficulty with anger management? Another study that was done in 2001, and it stays pretty much the same for today, is that almost 50% of those driving after a TBI reported irritability, anger management, aggression, memory problems, weakness, tiredness, sleep disturbances, problems with concentration and attention, balance, coordination, and lack of insight. So that sums up everything that I've talked about so far with both our physical and our cognitive abilities.
So we've talked about kind of all of the components that make up driving itself. So who would benefit from a driving evaluation? As we've talked previously, obviously you guys are all here for the traumatic brain injury piece, but we're also looking at maybe if somebody had a stroke or they're having some early signs of dementia or Alzheimer's. Obviously, you can see that those components that we've talked about previously would also be beneficial for a driving evaluation. We've also done evaluations for driving on somebody that has those physical changes. Maybe it's just an age-related change and they're gradually moving slower, or things are just a little bit more difficult and aren't as fluid as they used to be, or maybe there was an amputation. As we look at the physical piece as well, you know, is there Parkinson's? Is there some kind of tremor that we have to see if a patient is still apt to drive? Or is there some changes in memory, similar to kind of that dementia or Alzheimer's piece? Are they getting lost? Is somebody forgetting maybe to take their medications that day? You know, there's all of these different components, both physically and mentally, that we're looking at. So making sure that they're still safe to be on the road. Will they be able to respond quick enough to a changing stoplight or to something running out in front of them, things like that. So we've talked about all of these other aspects. So does this apply to you? So maybe you we were reading something and you're like, oh yeah, I have that, or a patient of mine has that, or a family member has that. So is there a personal concern for yourself or for your parent or your loved one? Do you feel like somebody that you know or yourself are having difficulty kind of determining that level of pressure like Joy talked about? So she talked about previously, you know, just that the sensation and the differentiating between the two. Do you have the sensation to be able to do that? Do you have the strength to hold up your arms to drive for 20 minutes, for 10 minutes, for 2 hours? Maybe you're driving from Grand Forks to Jamestown. Is there maybe some difficulty with this sustained pressure or applying this pressure where maybe adaptive equipment is needed? Maybe you need something that makes driving a little bit easier for you. You're still safe to drive, you just physically have some limitations. Maybe there's some weakness involved. You know, you've had a stroke or a TBI and now my left leg isn't as strong as it used to be, or my right leg isn't as strong as it used to be. So my leg gets tired when I have to hold the pressure down on the brake, or I have to hold my arms up to drive. Or maybe I have a bad shoulder and I need to kind of modify my driving technique as well. Do you have anxiety? Not necessarily just in general, but with driving or being behind the wheel. If we're anxious, we tend to not think as clearly. And so being behind the wheel can kind of alter those symptoms. And I'm going to backtrack a little bit. In the weakness component, we've talked about arms and the legs, but also looking at that trunk control and that trunk strength. So are you able to maintain an upright position for those 10 minutes, those 20 minutes, that hour long? Maybe something that we've talked about previously has triggered something, or you have difficulty learning a new activity, or difficulty following directions, like Joy had mentioned in some of those research articles. You know, it's difficult to kind of be insightful to your own deficits, or to recall your own, you know, the memory component of it. So if that's difficult, you know, maybe it's a good time to have an assessment for your driving. Do you get lost in familiar or new environments? Like Joy said, you know, driving through a familiar area and now there's construction, or maybe you're driving and a car accident happens, or there's inclement weather. Are you able to kind of redirect yourself? Or you took a wrong turn, can you redirect yourself to get back on track safely? And then similar to kind of what we talked about with the weakness, are you fatigued? How long can you go well being mentally engaged and physically engaged in a task before you get tired? After a traumatic brain injury, sometimes, you know, we can be more fatigued because our brain and our body just went through this huge trauma. And so it's healing, and fatigue is kind of part of that. As we're healing, our body is trying to focus all of its energy on healing, not necessarily staying awake or sending the strength to X muscle group as we're working. So what can you expect if you feel like you, a family member, or one of your patients needs a driving eval? We're speaking strictly from All Truths policy because that's all we know. But our test itself is a 2-part test. So the first test is in clinic, and the second one is behind the wheel. So when we're setting these up, we do request that a driver brings the specific patient that's being evaluated to their appointment. If there's already a concern, obviously we don't necessarily want you on the road until we've tested it to make sure. That being said, if there is a concern, we don't want you driving home afterwards. We want everybody, including the community, to still be safe. So we do request that the individual being evaluated is brought to their appointment.
So now we come into what does the evaluation really entail? And I want to take a step back, and it's like, why do we as occupational therapists do this evaluation? Why doesn't the doctor just make the decision to revoke somebody's license or the state. There's a couple of reasons for that. There's a lot of times that a family or the physician may suspect that there are difficulties and that the safety behind the wheel is coming into question. But without some objective documentation, it's really hard to make that determination. Nobody wants to take somebody's driver's license away. We don't want to take that independence. So it's very difficult. And I think for a physician to just automatically decide that they're going to take their patient's driver's license, that can really cause some conflict in the relationship that they have to maintain with that patient. So by sending them to someone completely out of the picture that can look at things objectively and make the recommendation, that takes some of that pressure off of the physician, and it takes the pressure off of the family when Emily or I are the ones that say you should not return to driving. So that's just kind of a...
And piggybacking off of Joy's point, an occupational therapist, for those that don't know, is looking at your daily occupation. So your morning routine, your leisure activities, your work tasks, kind of all of those components is part of our job. We're looking at how are you safe? Is it functional? Can we do anything to make you more functional or safe in completing those tasks? So that's kind of how the OT component fits with the driving evaluation as well.
Yeah. So when we get the person in the clinic, as Emily said, we like to have somebody bring the person that's being evaluated. And the main reason is because of the safety. If there's any issues with you leaving our clinic and we've already determined that you're not safe, we don't want you to be out and have any kind of problems. The other reason that we like to have somebody come with the person is that we like to have that individual back with us in the clinic setting when we're doing our cognitive evaluation or doing our pre-work screening. There's many times that I've had a patient back there and I ask a question such as, have you had any accidents in the last 1 to 2 years? Oh no, I've been driving for 60 years and I've never ever had an accident. And then the family member looks and says, well, no, you had that fender bender last October and you got a ticket. So it helps to reinforce some of the things that are happening. And so the other reason that I like to have family in is, again, I've had family members bring their parent and they're talking and with the fact that, well, my sister thinks that we should be taking dad's driver's license away because he's not safe. I'm like, okay. And how do you feel? I have driven with him and I don't see any issues at all. Okay. All right. Well, that's good. You know, this is either going to reinforce one or the other. And so we go through the whole in-clinic evaluation, and I'm watching this daughter as she's sitting at the other end of the table, and you could tell that she is shocked at what she's actually seeing happening with her family member. In this particular instance that I'm referring to, the daughter got up and excused herself from the table several times to go over and wipe her tears because she was feeling so badly as to what was happening in the evaluation. So it can be a very eye-opening experience. On the flip side, we can have that family member who thinks their parent's license should be revoked, and they're sitting in this evaluation, and I'm going, wow, that's really good. And we get to the end, and I'm thinking, I have no problem taking you out in the car. And the kid is going, are you kidding me? So it can be a reinforcer either way, positive or negative. But once we're back into the clinic, we're looking, I first off talk about the driving history. So where does the person drive? How often are they driving? Who rides with them? Do they drive at night? Do they drive during the day? Have they had any accidents? We talked about that a little bit. Are they driving in town? Do they drive in Grand Forks or Fargo, or do they drive out in Thompson, North Dakota, which is a very small community? So it really makes a difference as to where they're at. So we're looking at that, kind of the first thing for me anyway. And then we go into our cognitive evaluation. We talked earlier that we're looking at the executive functioning, visual spatial abilities. So how can you pick something out from your environment? We're looking at language. We're looking at delayed recall, short-term memory, attention, orientation, all of those types of things. And it's often when we're in the middle of this that the family member might ask, can I help my dad if he has trouble with reading or understanding directions? And this is the point where we say, no, this is where you have to kind of sit back and just observe, because that's what we're evaluating, is how can they understand what is happening.
And to piggyback off that, like, we're not drilling them on their reading abilities or anything like that. So it's at a level that they should be able to understand when we're presenting it to them, that you would need for driving or for passing your initial driving test. So it sounds harsh that we won't let them help, but in the same token, you know, it is what we are looking at for that component.
Correct. Yep. During that in clinic, we're also looking at the behaviors, that irritability, the impulsivity, because we'll see some of those in that cognitive assessment. We will do the physical assessment. So we do a basic range of motion and manual muscle testing for both the upper extremities and the lower extremities. We do sensation and coordination testing. We're looking at reaction times. Can they make that quick decision? Can they move that foot from the gas to the brake? That type of thing. We also are looking at visual acuity. Visual acuity, that's the numbers you get from your eye doctor. The state of North Dakota requires at least 20/40 visual acuity as a minimum in both eyes together with corrective lenses. Visual field, again, is how far can you see out to the side without turning your head. Again, the state of North Dakota requires 105 degrees of peripheral vision in both eyes. So that being said, I've kind of covered basically what we do in the in-clinic evaluation. Typically, this is covered by insurance with a physician referral. And just to back up, we don't see anybody without a physician referral, whether it's going to be completely self-pay or if we bill this first part to insurance, we require a referral no matter what.
And I did see that there was a question about Medicare specifically. We have had in the past, Medicare has covered the in-clinic component. So I did see that question come down. So once you've completed the in-clinic portion, we complete the behind the wheel part. So we don't do the behind the wheel unless you've passed the in-clinic. The in-clinic piece, we should mention too, that we do our assessment with some distractions around you. It's not like we're playing music and stuff like that, but there is people passing kind of as we're doing our evaluation. And that's for us to determine, can you tune out those distractions? You know, we're not trying to distract you while you're doing the cognition piece, but can you tune them out and pay attention to what we're doing? Because you're always going to have those traffic signs or other cars or distractions, radio, phone going on while you're driving. So once we're behind the wheel, we're looking at, maybe there was some concerns about memory or the visual spatial piece. But you still pass the in-clinic piece. So we'll still be looking at those concerns when we're behind the wheel. But we're also going to take you in various levels of traffic. So like Joy mentioned, we're trying to simulate your driving. Maybe you only drive in Grand Forks and you drive in Larimore or in these small towns, or you just drive in rural North Dakota. Maybe you have no concerns and you drive all over, gravel, highway, interstate, metropolis, downtown Minneapolis. So we try and simulate, obviously we can't do the Minneapolis piece, but we try and simulate your driving environment the best that we can. So we'll take you to a residential part of town and then kind of build up your speed from there. Or maybe we start in the small town and we build from there once you're more comfortable. Again, kind of like we had mentioned before, we're looking at, are you safe to be behind the wheel? Are you stopping at stop signs? Are you aware of pedestrians? Are you following the rules of the road? So are you going the appropriate speed? Are you in the center of your lane, or are you riding that center line to the point where a car thinks that you're going to hit them? Or maybe it's the opposite. Maybe you're almost taking out a mirror on the right-hand side. How is your acceleration and deceleration? Are you a really bumpy driver where we're getting whiplash in the passenger seat? Or are you pretty smooth and fluid with your
Starting and stopping.
Right, with your acceleration. How is your behaviors in the car? I know we had kind of touched on it previously with the frustration and the impulsivity, but are you able to maintain your composure? Maybe there's a car behind you because you're driving a little bit on the slower side, or something happens. Are you able to maintain that frustration without getting overwhelmed? Are you able to complete the pathfinding once we're behind the wheel? Are you able to find your way back to maybe a main road, or if there's construction going on, do you know how to go around it safely? If you're from a smaller community, maybe we'll take you to the smaller community at that level of traffic, but can you still kind of problem solve those areas? How are you with direction following? So if we say in 2 stop signs, take a left, are you able to remember that while we're talking to you? Because you'd have to pick out those things and problem solve those things as you're driving.
I'm going to step in here for just a second. When you say that, we have a small town around here that we frequently will take people to, and I will purposely attempt to trick them, I guess you could say, because we try to get people to do multi-step directions. And so there's this one street in this town that when you come up on it, it's a one-way. And so I will have told the person 2 or 3 stop signs previously, I want you to go through 2 stop signs and then take a right. Okay, so we get up there and get to the stop sign, and sometimes they will go ahead and take the right. And other people will look at me and say, are you trying to trick me? Because this is a one-way, I have to go left. I'm like, you just passed that part of the test. So we will do those things to see if they are following the rules of the road or how well they're following directions.
I saw a question come down. How much would the in-clinic session cost if it was self-pay? I've never had where it's self-pay.
I haven't either.
But it would be treated as an OT evaluation, which I think is, don't quote me, but I want to say an OT evaluation self-pay is like $307 or $340. And that's just a guess. So we've never not had the in-clinic portion covered because there's always a physician referral, and then the OT evaluation falls under that because it's considered an OT evaluation like you would have if you had a hand surgery or a shoulder surgery.
Although I will say there are times that I know that it has ended up not being covered, but I don't know what the person ended up paying if Altru just said okay or whatever. But there is always the chance, even with the in-clinic, that it may not be covered. We can't guarantee that.
We'll cover the behind the wheel cost here in just a little bit. So when we've kind of talked about what we're looking at behind the wheel, so now we'll talk about kind of the vehicle. So we use an alter vehicle for liability purposes. We currently have 2 vehicles. One is a Honda CRV and one is a Honda Accord. So a CRV is like a small SUV and the Accord's a car that we use for part of our driving program. Both of those cars are equipped with an instructor brake. So there's a brake on our side if in the case that we need to use it. Obviously, if we need to use it, that's not a good sign at all. Nobody else has an instructor brake in their car, so you should never have to use the instructor brake, but it's there for the odd chance that we do.
And we have.
And we have,
Many
yes,
times.
yes. So the Accord, the car is equipped with hand controls for individuals that may need maybe some training in that, or they use that as part of their driving. The CRV does not have the hand controls.
We do have the option to put a spinner knob in either vehicle. Say if someone has
Poor hand control.
poor hand control or they don't have function of their left arm, then they can use the spinner knob to make steering a little bit easier.
Mhm.
However, I want to preface that by saying you can't just get a spinner knob and put it in your vehicle, because the state of North Dakota requires that any modifications, and a spinner knob is a modification, you must retest with the state. So don't get the idea that if you have some weakness in one arm, you can do that. You have to be very cautious that you're still following the rules, and we'd hate for someone to get a ticket for doing something simple like that.
Yes. So when we're in the vehicle for the behind the wheel portion, there are no friends or family allowed in the vehicle for this portion. Liability purposes, obviously, but it also would increase the individual's anxiety. There's already enough anxiety when you're coming to see us, and we understand that. So one more person in the vehicle, sometimes personalities are just not good. So we aren't able to take family or friends. However, we do like that family or friend that was with us in the in-clinic portion meets us after we're done with the driving evaluation. We found that it helps with carryover of our recommendations. A family member that doesn't want to be there and test with us anyway isn't going to be maybe truthful to their family member. Oh yeah, they said I passed, when really there's these stipulations that we think we need to implement. But also just to kind of have more people on the patient's side as well. So we've kind of talked about that we do have the adaptive equipment that is needed, or this hand control and the spinner knob if it is needed. But we don't have some of those higher levels. So I think I'll talk about that in a little bit, but we're kind of your basic evaluation, and there is other clinics per se that have more specialized. So the one that comes to mind is Courage Kenny down in Minneapolis. They have some extra.
They have a full high-tech driving program. What we offer here is low-tech. So the adaptive equipment we have truly is different spinner knobs or knobs of some type that we could use, and the hand controls. So we are a low-tech clinic, but we can do those basics and refer you to the appropriate place if need be.
Mm-hmm. So I know the question had popped up of what is that out-of-pocket expense? So typically, I'd say 95% of the time, the behind the wheel is not covered by insurance. The out-of-pocket cost is $208 to complete the test. So that gets paid before we go behind the wheel. And then once that is paid, then we will go behind the wheel.
If they pass.
If they pass the in-clinic.
Okay, so we've completed the in-clinic portion of the evaluation. We've completed the behind the wheel. What happens next? Number one is what everybody wants to hear, or every driver wants to hear, is that they can continue driving without any restrictions. You're good, just be careful. It might be that they need to have some restrictions, and that might include not driving in inclement weather, not driving with questionable road conditions, only driving during certain parts of the day. So avoiding dusk or dawn, avoiding night driving. It might also be as restrictive as a limited radius from your home. And we have been able to do that. Another thing that we can do is once we've done that in clinic or behind the wheel portion, and we find that, you know, you're probably not safe to be driving with your right foot. Maybe we need to do some training on how to use hand controls. So that can be an addition to what we're able to do is we can do some training with adaptive equipment so that you can get back to doing what you want to do. And then the one that nobody wants to hear or no driver wants to hear is that we may need to recommend that you retire from being an active driver. If that is the case, we try to help you come up with some solutions. Is it family members or friends that can help get you to the places that you need to go? If you live in a bigger area like Grand Forks or Fargo, could you take Uber or Lyft or
The taxi
senior
service.
ride? Yeah. Out in the smaller communities, a lot of the counties now do have a public transportation. And so we could help come up with some of that. It's never an easy thing to decide or to be told that you need to retire from driving. So we try to help make that transition as easy as we can. We do like to really reinforce to the family though, if your loved one has had to stop driving, they're going to depend on you for a lot of things. And it's not just the groceries and the doctor appointments that are important, but I think even more so is the things that are going to help that person maintain a real quality of life. And that means go out for ice cream every once in a while. Take the person out for a Sunday afternoon drive if that's what they enjoy. Make sure you pick them up and take them to the grandkids sporting events, those kinds of things. Don't forget that they need to do that to maintain that quality just as much as you and I do.
And another restriction that I thought about as Joy was talking to is maybe we limit the number of people or who's in the vehicle.
Right.
Maybe it's nobody, maybe it's no grandkids, maybe it's a specific child that we know this patient won't have anxiety around, or, you know, those kinds of things as well.
So when we do make that or finish the evaluation, the person does need to meet with their physician to review the results of that test. Our assessment is strictly a recommendation to the patient, the family, and the provider. We as therapists cannot revoke a license. We can only make recommendations. The provider, the physician has to initiate any steps that would make those changes.
So the physician's role, in this case, your provider, will fill out the paperwork needed for the state. That's not actually coming from us. It will come from the physician or the provider that has sent us the referral. So maybe something we've touched on today has you interested. So what do you do next if you want to come see us? The first and foremost thing is to obtain that OT evaluation for driving from your physician. It can be your primary. For most insurances, it can be your primary, it can be neurology, even your eye doctor, if they have concerns, can even send you to us. And so once that referral is in place and sent to us, we start your state license verification. So one of our coworkers verifies that you do have a current license. If you do not have a current license, we do have the ability to apply for a temporary license and obtain a temporary license that is specific to complete your driving evaluation. We're not getting you a temp license. You can go around town for 2 weeks if you've had a revoked license. If you've had a revoked license, there's usually a cause or a reason. So you have a temp license to complete your driving evaluation with us that day. And we can do that for both North Dakota and Minnesota. I know we're talking strictly about North Dakota today, but we do have that ability. There's some time frames, obviously, to get those back. So sometimes that affects when we can schedule your appointments. Once we've had your state license verified or the temp license obtained, then we can go ahead and schedule the appointment. Sometimes we'll schedule the appointment and do it 4 weeks out or 6 weeks out, depending on the state, to allow us some time to get that information back as well. So if you're out of Altru's network and you want to come to Grand Forks, we just ask that you have your physician send the referral to us or to the closest clinic. I think Fargo and Bismarck also.
Fargo and Bismarck are the other areas that do have driving evaluations.
I see a question. Is there an evaluation for commercial driving fitness?
So that's a good question. We can do our basic evaluation like we've talked about. We can take the person out into the community in one of our vehicles. We do not have the ability right now to take you out in a semi or anything like that. We can do the groundwork, and then you would have to go to a driving school or the state, somebody that has the ability to test you in that capacity. Good questions.
Yes. So like we touched on earlier too, once that referral is sent into us or to Fargo or Bismarck, then we start the process once the referral comes in. If for some reason there's a more advanced or more complicated case where you maybe need additional adaptive equipment, we can typically tell you over the phone or based on your referral whether or not it's appropriate for you to come in to see us or to go to Courage Kenny. Obviously, if you have questions, feel free to contact us. I think our email was in the general description that was sent out to everybody.
I don't know.
Otherwise, if you would like to schedule the appointment once that information is in, our contact center's number is listed here. Anybody have any questions that we haven't already talked about?
So I know you were kind of following the ones in the Q&A, but did you get the 2 that are in there right now? Is there an evaluation for commercial driving fitness?
Yep, we answered that one.
I apologize.
And we did the behind the wheel cost.
Yep, and then the behind the wheel cost was $208.
Perfect. Thank you so much. Sorry about that.
Was there any other questions from anybody?
Not seeing any.
I would say the one thing that we didn't really address in the talk was new drivers. So a teenager or even a young adult that has never driven, hasn't had a license previously, we are not able to see them because we are not a driving school. So we can't do the education for a new driver.
I saw Marie just pop back in and I typed it to you, but it was $208 for that behind the wheel cost.
Thank you so much. All right. Okay, well, yeah, if you guys think of any later on, let us know. But otherwise, we'll let these ladies get back to their day, and we're going to move on to a break until 3:15. So we will see you back here at 3:15.
Thanks, everybody.
Thank you.
For our last speaker, and and after that, we'll do our awards and recognitions and things, and send you on your way. So we're almost done. Thanks, guys.
Thank you.